Hello again. This is Respiratory System Notes Part 3, and today we're going to try to do pages 4 and 5. It might get a little long, so if it does, remember you can always pause, take a break, and come back to it whenever you need to. All right, we left off right at the top of page 4, and here we go. So, the pharynx is common space used by both the respiratory and digestive systems. We commonly call it the throat, and you can look and see the top part of your pharynx pretty easily if you open your mouth and say ah, like they have you do when you go to the doctor. It originates posterior to the nasal and oral cavities and extends inferiorly near the level of the bifurcation of the larynx and esophagus. So it goes basically to where the larynx and the esophagus separate. So your throat includes passageways for both air and food. And we'll give you a little bit there to get that stuff down. And again, if you open your mouth and say ah, you will see the soft palate at the top of your mouth. And then behind the uvula, which is the thing that dangles down there, is your pharynx. The tonsils are on either side of it, and the pharynx goes down to about the level of your voice box. Okay, so that's the end of the upper respiratory tract. And if you remember, we talked about the upper and lower respiratory tract, and we also talked about conducting and respiratory separations. So in the lower respiratory tract, the conducting airways include the trachea, the bronchi, up to the terminal bronchioles. And then the respiratory system include the respiratory bronchioles, the alveolar ducts, and the alveoli. So continuing on from the pharynx, we have the larynx, which is the voice box. It's a short, somewhat cylindrical airway ending in the trachea. Lots of different things going on here. It prevents swallowed materials from entering the lower respiratory tract. It keeps you from choking, basically, and conducts air into the lower respiratory tract. It also produces sound. This is where your voice comes from. And it is supported by a framework of 9 pieces of cartilage, 3 individual pieces, and 3 cartilage pairs that are held in place by ligaments and muscles. And you can feel your larynx at the front of your throat, on the outside. And if you look here, okay, this is from the front. So there is the hyoid bone at the top. Lots of cartilage pieces that help to keep it open, including as we go down to the trachea. We'll get there in a second, but there's the different cartilage pieces. We're going to talk about the epiglottis in just a minute, but there are lots of supports for the larynx. The muscular walls aid in voice production and the swallowing reflex. Please make note we're switching over to page 5. But when you swallow, if you put your hand on your larynx, you can feel it move up and down. And yes, I just did that. I know you can't see me. The glottis is the superior opening of the larynx. And again, superior, reminder, means top. The epiglottis prevents food and drink from entering the airway when you swallow. So when you swallow, the epiglottis closes over the top of the trachea so that food doesn't go down into your trachea, your bronchi, and your lungs. or beverage for that matter. Liquids don't go down that way either. And the lining of all of these parts include those pseudostratified ciliated columnar epithelium that produces the mucus and has the cilia that moves the mucus along to help keep foreign things out of the lungs. Just a side note, if the epiglottis gets infected, it can make it difficult to breathe because it doesn't open all the way. And that is not a good thing either. So you want to make sure that you do your best to prevent yourself from getting infections. Okay. The conducting zones of the lower respiratory tract. You have the trachea, and you have the various bronchial tubes that go down into the lungs, and there are many branches of these tubes ending up ultimately in the respiratory surfaces. The trachea is a flexible tube, also called the windpipe. It extends through the mediastinum and lies anterior to the esophagus and inferior to the larynx. So it's below the larynx and in front of the esophagus. The anterior and lateral walls of the trachea supported by 15 to 20 C-shaped tracheal cartilages. So in other words, it keeps the tube open so air can go through. Cartilage rings reinforce and provide rigidity to the tracheal wall to ensure that the trachea remains open at all times. And again, lined by ciliated, pseudostratified, columnar epithelium. Those cells that produce mucus and have cilia on them to help keep stuff from moving down into the lungs. Now, I don't know why, but there doesn't seem to be a place for you to record this in your notes. It is kind of a structural thing to look at. The bronchial tree, once the trachea, it first branches into two large branches, and then you get the secondary bronchi, which goes into the different lobes of the lung. The left lung has 2 secondary bronchi, and the right lung has 3 secondary bronchi, and we'll talk about why that is in a second. And then they further divide into the tertiary bronchi. So it goes secondary bronchi, tertiary bronchi, bronchioles, and then terminal bronchioles. And each successive branching, the amount of cartilage decreases and the amount of smooth muscle increases. This allows for variation in airway diameter. In other words, the tubes can be open wider or smaller. The more muscle, the more variation. Okay, the respiratory zone for the lower respiratory tract. And again, this is where the air exchange occurs. When you get down to the respiratory bronchioles, there are alveoli there. Each alveoli is surrounded by many blood vessels, tiny little capillaries. And the alveoli is really where the air exchange, the gas exchange occurs with the blood. So, and there's some good information in the video, the respiratory system overview video that I put on Edpuzzle for you to watch. If you go in Canvas, you'll find it in there if you haven't already done so. All right, so where are all these tiny little bronchioles and alveoli? They are located in the lungs. And again, here's the basic structure. Now, if you look here, and we'll talk about this in a second. So all of this from the trachea on down is in your chest area. If you notice here, there are 3 lobes of the lung over here and only 2 over here. We'll write that down in a second. Underneath the lungs is the diaphragm. The ribs are normally found on front and behind. They help protect the lungs and the lung space. And underneath you have the diaphragm, and we will talk in a second about why it's not a perfect symmetry here. Okay, so the left lung is divided into 2 lobes, and it is smaller than the right lung. And the right lung is divided into 3 lobes by oblique and horizontal fissure. Okay, so why are there only 2 lobes on the left? What's over on the left-hand side besides the lungs? Of course, the heart is slightly to the left of center. So the heart is over there. You also have a little bit of space there with the stomach coming up through that area as well. Or I should say going down through that area as well. Okay. The alveoli. The alveoli are made up of simple squamous cells and elastic connective tissue. Macrophages and phagocytes move around to get rid of any debris that the ciliated epithelium may not have. So even if stuff gets down into the lungs, there are macrophages and phagocytes that spend their time there trying to make sure that all of those things get removed so that the lung is not damaged. Surrounding each alveoli are capillaries that carry blood and allow for gas exchange to take place. And I think we'll stop there with this particular one. If you do look, you do have at the top of the next page an image of the alveoli, the same one that's at the top corner of this slide over here. So you can kind of see what is going on there. Have a great day. Take a look at that video that I put in Edpuzzle, and that has some nice images and explanations in there that will help us with our next part as well.